So the pancreas has two functions in the body, and I guess just to be clear about this, your pancreas is a small pink sort of L-shaped organ that sits basically next to your stomach and is attached to your stomach. The two functions of the pancreas, one is production of digestion enzymes and the second is production of metabolic enzymes. So the first one provides enzymes to digest food, the second one produces things like insulin, which is to absorb sugar into your body. In both cases, the pancreas is secretory, so it's secreting these enzymes into the body to do their job. We have acute pancreatitis, which is a very sudden onset, rapid, severe, awful pancreatitis. We also have chronic pancreatitis, which is the more smouldering, long-term form, and that can be quite difficult to diagnose but can lead to very long-term problems, like for example diabetes through destruction of the pancreatic tissue. Acute pancreatitis is kind of the disaster situation emergency, and you have the dog or cat who comes in, severe abdominal pain, vomiting, won't eat anything, won't drink anything, dehydrated, extremely sick. And that one can become life and death, and that's quite a serious problem. Needs rapid emergency treatment to get it fixed. The second type, chronic pancreatitis, is more the longer term, slow destruction of the pancreas, which is quite often due to immune problems or immune-based problems or long-term infections. And kind of the problem we see with that is quite a bit of damage can be done before we even recognise there's damage, and we can be left with a dog or a cat who's got a poorly functioning pancreas, which is difficult to bring back. Looking for those digestive enzymes. So lipase and amylase in the blood is a very good test. However, these days a test called PLI, which is a pancreatic lipase, so it's much more specific for the pancreas rather than any body lipase. It's a much better test, and so we use pancreatic lipase mostly these days. That's a brilliant screening test. We are picking up many more cases of pancreatitis these days than we were 5 years ago, because we have that test and we can more easily identify the mild smouldering cases. So I think most diagnosis is based on clinical signs, so vomiting, very painful abdomen, not eating, not drinking, the blood test, especially the PLI, and probably an ultrasound. If I had a really mild case, like a dog or cat who was just a bit sick and just vomiting a bit, but they could still drink water and they're okay, I'd probably give them a very bland diet and medicine to control any nausea and pain, and probably send them home with rest. You know, make sure they stay rested, well hydrated, and go home. That would be a really mild case, but most cases of pancreatitis end up in hospital, at least for a couple of days. The biggest difference we see is made by rapid and aggressive fluid therapy. So putting an animal on a drip and rehydrating them as quickly as possible. If we can do that, we can flush that pancreas out, get all those bad digestive enzymes out, and get the pancreas functioning more normally again. And that seems to be the number one thing that makes a huge difference to these dogs and cats getting better quickly.